There are three layers that are called the meninges that surround the spinal cord. These layers are continuous with the same layers that surround the brain. So let's go from superficial to deep, moving upwards on this list. Deep to the epidural space. All right, I'm sorry. Bone, epidural space. Let's draw some bone. Sorry about that. Here's some bone. This here is the epidural space. Deep to the epidural space is the dura mater, which is this double-layered membrane right here. The name of this layer means tough mother. The second meningeal layer is this pink layer right here, and this is what is called the arachnoid mater. This layer gets its names from the many collagen fibers that separate the arachnoid mater from the third layer, which is the purple layer here, that is called the pia mater. These collagen fibers, they create something of a cobweb-like appearance, and the space deep to the arachnoid mater is called the subarachnoid space, sub-A. Right? You can see all the collagen fibers holding open that subarachnoid space. This space is filled with cerebrospinal fluid. And this fluid is basically just filtered blood that runs through the arachnoid space surrounding the entire spinal cord and surrounding the entire brain, because these layers are continuous with it. The third and deepest spinal meninges is called the pia mater, and this word pia means soft. The pia mater, as you can see, it clings to the spinal cord much like a stocking. And the purple colored pia mater here, it dips into the anterior fissure and the posterior medial sulcus. Remember that these two features, the fissure and the sulcus, they allow us to determine that the top of this picture here is the dorsal side of the spinal cord, and that the bottom of this picture here is the ventral side of the spinal cord. In the vertebral foramen, between the first meningeal layer and the bone itself, is the epidural space, which is filled with adipose or fat. This area is a great injection site for non-polar lipid-based medications such as regional anesthetics. Because regional anesthetics are non-polar, and so is the adipose connective tissue that fills the epidural space, these medications are able to diffuse out from the injection site. So, if you are unsure if your patient needs an epidural shot at L4 or 5 or L3, L4, it doesn't matter. Inject them at the more superior spinal level and let gravity do the rest. Seriously. When someone says they are getting an epidural, that just indicates the area of the injection. What they're injecting is usually a steroid medication to reduce inflammation or an anesthetic medication to reduce sensations received by the spinal cord in that area. An epidural injection is usually putting some type of medication into this epidural space. Conversely to that, a spinal tap is withdrawing some fluid from the spinal cord. The fluid filling the arachnoid space circulates around the spinal cord and the brain, and I want to sample that. This cerebrospinal fluid, although it's made from blood, it is distinctly different from blood. There are things in blood that you would never expose your nervous tissue to, and these things are not in the cerebrospinal fluid. So, for example, and before I do that, I want to draw a big needle coming into the subarachnoid space. indicating that we are able to withdraw fluid from, hey, there's my spinal tap. For example, though, there are little substances called ketone bodies that are created in times of starvation. Ketone bodies are able to change the pH of your cerebrospinal fluid and affect the functioning of your central nervous system. The only way to tell if these ketone bodies are entering into your cerebrospinal fluid would be to withdraw some of said fluid. And when we withdraw cerebrospinal fluid from the subarachnoid space, this is what is called a spinal tap. Therefore, a spinal tap allows us to sample that selectively filtered cerebrospinal fluid. Before we leave this mini lecture, we should answer the question, what is meningitis? Short and sweet definition, it's the inflammation of these meningeal layers. Meningitis, spinal meningitis, usually occurs from an infection due to a bacterium or a virus. If it's a virus, good luck, you'll get sick, but you'll get better. If it's a bacterium, good luck, you'll get sick, you may die. This is because we don't have antibiotics that can cross what is called the blood-brain barrier and get into that cerebrospinal fluid. The blood-brain barrier should be called the blood-brain spinal cord barrier because what it does is prevent things that are circulating in the blood from getting into the CSF. And antibiotics, although helpful in battling bacterial infections, antibiotics are looked at as toxins by your nervous tissue. And therefore, I can't get antibiotics to the place where that bacterial colony is growing completely unchecked.